Breast cancer can be normal, but sometimes it is a warning sign. So how do you know when it's harmless and when you should worry? If you've ever noticed fluid coming out from your nipple and quickly brushed it off, you're not alone. A lot of women usually experience this, breast discharge at some point in their life, and most times it's not always linked to cancer. But some types of breast discharge should never ever be ignored. So in this video, I'll explain what breast discharge is, when it is normal, what colors are dangerous, when to see a doctor immediately, and the common myths that make women delay care. Now, what is breast discharge? Breast discharge is any fluid that comes out of the nipples when it is pressed or sometimes on its own. It can happen in pregnant or breastfeeding women with hormonal changes, women who are taking certain medications, but not all discharge is normal, especially if you're not breastfeeding. Now let's look at some normal, less worrisome kind of discharge. You usually do not need to panic if the discharge is milky and that you're pregnant or you're a breastfeeding mom. If it comes from both breasts, or if it only happens when you squeeze the nipple and that the color is clear, white or slightly yellow, and that you observe that there is no pain or lump or even skin changes, then there is nothing to panic about. The only thing you can do is to speak to your healthcare provider during a routine checkup, or you speak to your doctor about it. So at this point, there is no cause for alarm for breast cancer. Now let's look at the part where you should worry about. This is the most important part. You should see a doctor as soon as possible if the discharge is bloody or blood stained, if it is dark or black, if you notice a green color with foul smell or coming from only one breast, if you notice that the discharge is happening without you even having to squeeze it, or if you notice that this discharge that you're experiencing is associated with a lump or a nipple invasion, pain, or even skin changes, all of these could indicate so many things. It could indicate infection, it could indicate hormonal disorders, it could indicate benign growth, or in rare cases, breast cancer. So aside all of this, there are some common myths that are very, very dangerous, and it is usually based on the assumption of most individuals. Some women might feel that because it's not painful, therefore it's nothing, or they might even feel that, oh, they're too young for breast cancer, or it will stop on its own. And most of the worst of it all is that some people assume it's spiritual and not medical. I want you to bear in mind that ignoring symptoms, delays diagnosis, and remember that early detection has saved a lot of lives. Now, what do you do if you notice discharge? The first thing you do is that you don't squeeze your breast repeatedly. Another one is that you note the color. Take note of the color, the smell, and the frequency of the discharge. You can also check if it's just coming from one breast or both breasts. And most important of all, see a healthcare professional. Ask for proper tests if it is necessary. So remember that breast discharge doesn't always mean cancer, but your body is always talking to you. So listening early can prevent serious problems later on. And if something feels unusual, do not ignore it. As I always say, your health is worth checking. Now, if this video has helped you, please give it a like, subscribe to this channel for more health content, and I'll see you guys in my next video. Bye.